All right, Dr. KEHINDE ELISHA speaking here. We're going through foundations. As part of the foundations, we normally go through guidelines. We normally go through lab values. We normally go through roles, leadership, and ethical principles, and in general, maybe our nine competencies that we use as advanced practice registered nurses. We also go through serology. We go through things that you know that they will be showing up as you go through the body systems, but we don't really put time into them. We go through antibiotics. Those are all part of the foundation. So now the next thing we're going to go over right now is going to be labs and indications. So don't forget, we have the CBC, that is complete blood count. We have the BMP. We have the comprehensive metabolic panel. We have the lipid panel. We have the hemoglobin A1C, thyroid panel, urinalysis, vitamin D, ferritin, our iron studies. We have prothrombin time. We have partial prothromblastin time. We have the C reactive protein, the erythrocyte sedimentation rate. We have liver function tests. We have blood cultures. We have the hepatic panel. We have troponin. We have the BMP. We have the D-dimer, arterial blood gases, H. pylori test. We have the stool occult blood test. We have the lead levels. We also have drugs that we need to monitor before we give them and after we give them and when they are on them. Examining body will also throw you into that, I don't know what to call it, circle. You have to know how to untangle all that too. And then indications of lab, why do we need certain labs and stuff like that? I will go through all that. So let's quickly begin with the foundations. What is the foundations of lab and how should we learn lab? Dr. KEHINDE ELISHA speaking here, founder of NP Certification Academy, www.npcertificationacademy.com. We offer PMHMP, FMP, AGMP, AGA, CMP, and NCLEX exam review with 99.9% pass rate. Why don't you look us up? Now, we're now going to first of all start with complete blood count. What is the purpose of it? What is the main indication of it? It is used to detect anemia, infections, clotting disorders, leukemia, and overall blood health. So you want to remember, first of all, what goes under the CBC. You want to know that we have WBC underneath it, and you want to know that we have, and if WBC is underneath it, what is it used for? We use that to pick up what bacterial infection. We also have our hemoglobin underneath it. And we have different numbers for hemoglobins too, male, female. This is not all comprehensive. This is just a starting point. You got to know something for this exam. You can't be clueless. No matter how little, you have to know something. So even if you know two things that are underneath CBC, it is plenty. Does it make sense for a start? And you know what CBC is used for, especially for those of us that have not been in clinics lately, or for those of us that have not been working lately as a nurse or as an MP, you have to get yourself familiar and get started somewhere. The next component of lab we're going to talk about is the BMP. So what is the BMP? It is what? The basic metabolic panel. And what does it do? Normally, it evaluates kidney function, electrolyte imbalances, glucose levels, and acid-base balance. You must be able to articulate what it does. You must be able to define it any day, any time, as a provider, even as a nurse. So now, creatinine. We know that something is not right with the kidney. When we see low potassium, when we know there is hypokalemia, and it might be due to diuretics, and this is why we actually use this to we actually go ahead and monitor this as we have our patient on certain meds. So now, what you are measuring also tells you what the component is. So what do we normally have under the BMP? So we can have creatinine, we can have potassium, and a few other electrolytes. Now let's talk about the comprehensive metabolic panel. Listen, BMP is not the same thing as CMP. BMP is basic metabolic panel. CMP is comprehensive metabolic panel. So what is BMP then? So it includes what? Our liver test, our metabolic function. Like somebody's having hepatitis, you want to check ALT and AST level. You want to check, are they well nourished? What is going on with, do they have a liver disease? You want to check the albumin level. So now you have a couple of components underneath the CMP. So underneath the CMP, we have ALT or AST, and we have albumin. Underneath the BMP, we have potassium and creatinine. We have more than that. It's not all inclusive, but just start with two things at a time. Under the CBC, we have what? Hemoglobin and WBC, and of course, a lot more. The next lab we're going to talk about right now is going to be the lipid panel. Now, lipid panel, what does it do? It evaluates cholesterol levels for cardiovascular risk. What are the things that we tend to see under the lipid panel? I think this is pretty much a given. We see the LDL and HDL and a few other ones. So for now, just connect the dots that, okay, the components of the lipid panel is going to be LDL, which of course we have to know that if it is high, that person have risk for atherosclerosis. Atherosclerosis is a big deal, real big deal. Why is this such a big deal? If it break loose, it can cause a stroke. Now, low LDL, H means happy. We want HDL to be a high number. When we do have a low HDL, it means the patient has a poor cardiovascular health. Now, the next thing we're going to talk about is hemoglobin A1C. So hemoglobin A1C, what does it do? It monitors long-term glucose control in people with diabetes. Again, this is a given. I think we know this, to be honest. We know that if it's more than 66.5, we can conveniently diagnose that patient with diabetes. Of course, don't forget, for every body system, like I said, there is a guideline. So there are guidelines to follow before we conclude, or before we make a conclusive diagnosis, or before we properly treat or guide our patient. There is a guideline that we must follow. Now, hemoglobin A1C more than 9%, poor glycemic control is what that means. So patient's intervention is definitely needed. The next thing is going to be thyroid panel. Thyroid panel is also a given. That one is also straightforward. It assesses thyroid function, hypo and hyperthyroidism. So if we have an ITSH, it means hypothyroidism. Example like Hashimoto's disease. We also have low TSH. When we have that, that means hyperthyroidism. That may mean Graves' disease. In fact, in psych, this is significant too. We tend to monitor thyroid level a lot. Now, when we have an ITSH in psych, when we have somebody with depression in psych, it could mean that they actually have depression. So we need to also screen them for hypothyroidism. When we have somebody that have anxiety in mental health, we also need to screen them for low TSH because they may have hyperthyroidism. The symptoms are very, 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 very close and similar when it comes to presentation. Now, so and that's the way you have to critically think. You have to find a way to combine things and make sense out of everything that you're doing. Urinalysis screens for UTI, kidney disease, and of course diabetes. So now when we have urinalysis, when we have positive leukocytosis and nitrates, it definitely means that the patient have UTI. When we have proteinuria, it means it's early kidney disease. So, and don't get me wrong too, if you have a little bit of protein in your urine, don't drive yourself crazy. People with hypertension and they are taking hypertensive medication, they tend to spill a little bit of urine every now and then. As long as it's not abundant or too much to cause any scary, to cause any scare. Now, what about vitamin D? Vitamin D assesses vitamin D levels for bone health and deficiency-related conditions. When we have low vitamin D, what does it mean? It means osteomalacia or rickets. When we have a high vitamin D level, it means you are over-supplementing yourself, and that is not good. You have to tone it down. Let me tell you something about vitamins too. Not every vitamin is good. Too much of vitamins is bad, as a matter of fact. And when you are taking multiple vitamins, make sure that you're not overdosing on it. See what I mean? Because every vitamin kind of contains the same similar things. Does it make sense? So if you're taking like 3 or 4 types of vitamins that are different products, different companies, your first bottle may have vitamin D in it. Your second bottle may have vitamin D in it. Your third bottle may have vitamin D in it. By the time you know it, you're overdosing yourself of vitamin D. So let's be very, very careful. What about ferritin iron studies? It is used to diagnose iron deficiency or overload. Low ferritin means iron deficiency anemia. And then we have PT, we have PTT, we have C-reactive protein. I think PTT kind of explain itself. Every nurse and every nurse practitioner definitely know what PT and PTT is, unless you're not a nurse. Now, we're going to skip that and go to C-reactive protein. C-reactive protein measures inflammation. That one is extremely important. It is non-specific marker for what infections, autoimmune diseases. And of course, the ICRP, that one means we have active rheumatoid going on. Mild elevation means what? That we have that person just finished having surgery. So after surgery, some people have a mild elevation, but sometimes then that's generally okay because that was triggered by something, right? Something that just happened to you. So that's different. But then when it's very, very high, it means we may have active rheumatoid going on. So it needs to be worked up further. What about erythrocyte sedimentation rate? It is a non-specific test for inflammation. What does it do? It's often seen in autoimmune conditions. So when we have an ESR, what does it mean? It means that we have systemic lupus erythematosus, and then we have a normal ESR, then it's a good way to rule out what? Inflammation. Liver function test. Now, liver function test evaluates liver damage or disease. Eye bilirubin, what does it mean? It means jaundice due to liver disease. But of course, there are other tests that will conclude that. So, not always so. What about IALP? That means you probably have like bone disease of some sort. Now, let's talk about blood cultures. We all know what blood culture is, especially if you work in the intensive care unit. Now, help us pick up whatever organism that we see in the bloodstream. Remember, my antibiotic lecture kind of tells you what antibiotic does. It kind of targets the enemy. So as the organisms are like, they are ready to eat us up, we are ready to chew them up too with what? Antibiotics. And that is why we must not overuse antibiotics, so that those organisms that are trying to like find techniques on how to get us, they will not build tolerance to those drugs. So we only give antibiotics as necessary. So going back to the topic, so blood cultures will identify bloodstream infections. For example, if we see something that is positive for staphylococcus, it means sepsis. If there is no growth, it means absence of bacteria. What about hepatic panel? Monitor liver function, of course, that and damage, elevated ALP, gallbladder obstruction, maybe going on when we see elevated ALP. When we see low albumin, we may be seeing it might be due to chronic liver disease. And troponin, BNP, D-dimer, I think we're all familiar with this. Arterial blood gases, H. pylori test, to stool, occult, lead levels, and so on and so on. So the next thing we're now going to talk about is drugs and what you need to monitor. You are now the provider. You are the one prescribing this medication. So that's why the exam is a little challenging. You got to remove that what? Uniform as a nurse, and start every day mentally put on what? Your coat, and be ready to prescribe and act in your role. Does it make sense? Especially as you walk into that test, you are no longer a registered nurse. You are an advanced practice registered nurse. Don't forget, we have LPN, we have RN. You are the APRN. So you are on top, meaning on an exam, listen, they're going to ask an LPN, do you know where the pulse is located? I give this example a lot because it's significant. They're going to ask an RN, do you know where the pulse is located, and do you know how to palpate it? Listen, an exam question is going to ask an APRN, do you know where the pulse is located? Do you know how to palpate it? Now, when you figure out there is a problem, do you know how to fix it? And do you know how to fix it not by guesswork? Do you know how to fix it with guidelines? And do you know how to stay within your scope? See? So it's multi-layered approach, right? You are loaded with a bunch of responsibility. And this is one of them. So let's get started. When you give your medications, before you give it, I hope you're going to do what you need to do. I hope you're going to monitor the necessary labs based on what is expected to be the drug-drug interaction, or based on what is expected to be a side effect of that drug or the adverse effect. So you want to go ahead and do something. Before you give that drug, you want to get a baseline lab. And while you are actually giving that drug, you want to do an ongoing lab. And when they stop the medication, you want to do a post lab. So it is something that you have to continually monitor. Not every drug, but most drugs are like that. Our cardiac drugs, our immune drugs, and so on and so forth. So look, the very first drug on the list is what? The antihypertensives. For example, what are the examples that I'm going to give here? Lisinopril, losartan, amlodipine, hydrochlorothiazide. What exactly is the purpose of it? They are used to help with hypertension, heart failure, CKD. What do we need to monitor for this drug? We have to definitely monitor what? You have to definitely monitor potassium, creatinine, sodium, blood pressure too. Even though it's not a lab like that, you have to monitor it. Let's go to the next medication. The next medication is going to be what? Anti-diabetes. So the anti-diabetic drug like metformin, insulin, GLP-1 agonists like what? Semaglutide, SLG2 inhibitors. You have to monitor labs for them. For example, now metformin, what lab is priority? Expect this on the exam, period. You have to expect this on the exam. You have to expect this on the exam. It is a fair exam too. Let us be very, very honest here. It is fair. for them to ask you this question that, hey, you're going to give me you're going to give me metformin. What lab do you want to monitor? Even if they don't ask you on the exam, listen, your patient is going to ask you too, do I need to worry about anything as I'm on this medication? Can you even educate your patient about this drug metformin? So those are things that will also be on the exam. So exam is actually doing you a favor to prepare you for what is to come so that you are not embarrassed in front of your patient. Listen, we're now going to go on to the next, to metformin, right? We're going to be doing BMP, hemoglobin A1C, and LFTs. What about insulin? What lab do you want to monitor for insulin? Hemoglobin A1C, blood glucose, BMP, specifically potassium. What about GLP-1 agonist? You want to monitor hemoglobin A1C, BMP. What about the SGLT2 inhibitors? BMP, like creatinine and potassium specifically. You want to also monitor hemoglobin A1C and, of course, urinalysis. What about statins? Atorvastatin, rosuvastatin. You want what is it used for? Of course, hyperlipidemia. You want to monitor lipid panel, keep eye on that, and LFTs. What about anticoagulants? Warfarin, apixaban, rivaroxaban. Of course, for warfarin, what do you specifically want to monitor? You want to monitor INR, PT, CBC. What about apixaban and rivaroxaban? You want to definitely check out the creatinine, renal function, and CBC. Antidepressant like sertraline, escitalopram. Don't forget, we have to be checking BMPs, TSH on this patient. We have to also check regular mental health assessments. That's not a lab, but that's kind of part of the assessment. What about bupropion? You want to be checking BMP. You want to, of course, also monitor their mental health using scales and all kind of things. Antibiotics. If you're giving amoxicillin or azithromycin, there is no routine lab that you really need to check. But if they are on this antibiotic for a long time, you may want to go ahead and check the CBC for sure. What about ciprofloxacin? You want to be checking creatinine for renal function. That's one of the effects that we see. Don't forget, the way to know what labs to check is if you know the side effect of this drug. And we do teach pharmacology separately where we talk about the pharmacology, the side effect, and all that. That will kind of also help you on what you need to monitor. Doxycycline, you want to check LFTs, you want to check renal function tests. And of course, especially if you're using it long term. When a patient is on NSAID like ibuprofen, like naproxen, what lab do you want to check? You want to go ahead and check BMP, CBC, especially based on chronicity. And you also want to check LFTs too, right? As a liver function test. What about PPIs like omeprazole, pantoprazole? You want to be checking magnesium levels if you're going to be using it for a long time. Asthma, COPD, albuterol, like, formoterol or butanide. There's no routine lab, but you want to definitely check if they have oral thrush. That's something that we chronically see in people taking all these inhalers. Now, what about thyroid hormones like levothyroxine? Of course, you want to monitor TSH and free T4 level. For bone health, like alendronate, we're using it for osteoporosis, right? You want to be checking calcium, vitamin D, and of course, bone density scan. Anticonvulsants like lamotrigine, levothyroxetam, you want to be checking CMP, CBC if we're using it for a long time. For dermatology, trinitoin, acne, that's what we use it for. Topical steroids, we use it for eczema, psoriasis. There is no routine monitoring for this group of drugs. Now, clinical conditions and labs. So look, when we have hypertension, coronary artery disease, the labs are pretty much consistent. If we have hypertension, we need to stay on our BMP, lipid panel, hemoglobin A1C, TSH, urinalysis, and of course EKG. That's also because of the meds that we're taking, right? A lot of it we take a hit on these systems, and we need to check out these organs and make sure that things are not going downhill. Usually yearly, unless something critical is going on, yearly routine is generally okay. Don't forget we have two separate guidelines for our blood pressure. JNC8 is still current, and then we have AHA guidelines. And then coronary artery disease, lipid panel, C-reactive protein, troponin, BMP, EKG, stress test, echocardiogram. We need that if we have coronary artery disease. What if we have heart failure, BMP, BNP, and BMP, two different things. B-natriuretic peptide, of course, and then basic metabolic profile, two different things. Echocardiogram, EKG needs to be routinely checked. Now, what about the endocrine system? If we have diabetes, of course, hemoglobin A1C, fasting blood glucose, OGTT, respiratory, we're checking spirometry, peak flow, gastrointestinal system, we're taking H. pylori testing. This looks pretty much straightforward according to the content. In our case studies, we've been through a lot of this already, so this should not be new to you. Infectious disease, musculoskeletal, we've seen all of this in multiple choice questions as well. I'm sorry, my phone is far away from me. I don't even know where it is. Sorry about that. Just give me a second. Let me pause that phone. All right, so sorry for that interruption. I try to keep it all under 20 minutes so that you can repeat it over and over and over again. I generally don't teach this fast. But if you want to sign up with us, www.npcertificationacademy.com with 99.9% pass rate. A lot goes into this bucket of exam. There's a lot that you have to know to pass the test. It's not just practicing questions. Content is key. There are no strategies without content. Absolutely none. Speaking as Dr. KEHINDE ELISHA, founder of MP Certification Academy. To reach us, nurse-to-nurse-coach@gmail.com or info@npcertificationacademy.com. You can also visit our website, www.npcertificationacademy.com. If you passed your board already and you're looking for a nice community of providers where you want to network, visit www.confidentprescriber.com. That is www.confidentprescriber.com. Stay safe as you practice as a clinician. I look forward to seeing you in our review. Have a wonderful day. Bye-bye.